Hello, welcome to the International Interprofessional Mentorship Meeting. I am Dr. Kate Barlow, the founder and host for today's meeting. It's June 13th, 2023. And today, Dr. Cathy Leslie and Dr. Stefanie Johnston are here to talk about positioning for torticollis in play. Please mute yourselves during the presentation, but you can unmute yourself whenever you want to ask a question, or you can type your question into the chat box and I will ask the questions for you. In order to receive a certificate of attendance, please complete the attendance link that I will be posting into the chat box. And at the end of the presentations, we will have a question and answer session and a meet and greet. Well, thank you so much, Cathy and Stefanie, for coming. We really appreciate you volunteering your time for us, and take it away.
All right, thanks so much, Kate. We're super happy to be here. My name is Cathy Leslie. I am an occupational therapist, and my clinical background is in early intervention, which in the United States is birth till children turn 3 for kiddos with disabilities and developmental delays. So I teach at the Mass General Hospital Institute for Health Professions in Boston, Massachusetts. And happy to be here. I'm presenting with Stefanie Johnston. Stefanie, do you want to introduce yourself?
Yeah, thank you. Hi, I'm Stefanie. I am an occupational therapist. I'm a new graduate. I went to MGH Institute of Health Professions in Boston for graduate school and graduated last year. And now I'm working at a pediatric sensory integration clinic in San Diego, California.
Great. Stefanie and I have added our emails on a slide at the end of the presentation. We're happy to reach out. Happy if you want to reach out if you have any questions or thoughts after this presentation. We're happy to connect with you. And I think that was it. We're looking forward to sharing some information about how positioning can affect play for children with and without disabilities, and for children that have a diagnosis of torticollis. So with that, our agenda today is we're going to introduce the idea of positioning and some basics. We're going to talk about positioning for play and also torticollis and some stretching and treatment ideas related to torticollis. So I did want to say that today the focus of this presentation is on babies and young children. I also wanted to share that many of the resources in this presentation were developed in the United States. So based on that, they do have a Western cultural view about what it means to think about child development and parenting, about where to place a child, about what your environment might look like. So when you think about using this information and the resources in this PowerPoint, I would suggest that you consider your unique cultures and the viewpoints of the families that you work with, and think about adaptations that you might need to make based on those cultures. I also wanted to say that the resources and videos in this presentation are free and publicly available, and there are resource slides at the end of the PowerPoint, which Dr. Barlow will be sharing with all of you. So you will have a copy of this presentation and links to all of the resources so that you can explore further and use them in your clinical practice. So positioning basics. So when providing positioning support for children, I think a key thing to think about is that less is better. We want the child to have stability and to be able to function, but we need them to be able to move freely. So the goal is structure, support, positioning that allows the child to feel secure, but leaves them as much freedom of movement as possible so that they can participate in their activities of daily living and play. So one of the big things that we think about when thinking about getting a child into a good position is that we want them to be stable in the main part of their body. So whether that's in sitting or standing or kneeling, that whole middle section of the trunk, the head, the shoulders, the more stable that can be, the more successful the child will be able to move their arms and hands in front of their body to complete activities. Another thing we're thinking about is symmetry and alignment. So we want the child to be positioned facing forward with symmetry. So we want both hands in front of the body, not just one. We want both shoulders straight, not just one. So we want the child's positions to be able to be varied and to change positions frequently. Another key thing to think about is that when we ask a child to do an activity or a play activity that is hard for the child to do, the more supported and secure they are, the more likely they can do that challenging activity. If a child does not have good positioning support, what happens is the child is so busy trying to maintain their posture and their position that there isn't a lot of room left to work on the task itself. So if a goal is to do a fine motor activity with their hands, we want the main part of their body to be as supported as possible. When we get them into that good position, the other thing we want to do is make sure that we're moving the things that we want them to use around, and that we're moving ourselves around so that the child is encouraged to reach and move and look all around them. So we want them to be able to look up, to look to both sides. We want them reaching across their body. And we don't want to keep them always in the same position, always facing forward. So we want them to be stable and be able to move and engage in the task. So there are a lot of benefits to getting children into these good positions. When a child is able to be positioned properly and they change their positions often, we can help with a lot of outcomes related to this. We know that good positioning helps prevent pressure sores, contractures, deformities, and also that it makes it easier for the child's family to take care of them. And so what I mean by that is the better a child is positioned, the easier it is to change their diaper, the easier it is to feed them, the easier it is to read to them. So good positioning also provides that stable base of support that we were just discussing that makes it easier to have successful functioning. The other thing that's important to think about is all children, once they turn 1 year old, need to spend time in standing. So we want weight on their feet flat on the floor, all children. So whether they can stand independently or not, whether we're positioning them with our hands or positioning them with adaptive positioning devices, it's really important that all children spend time on their feet. And the reason it's important is that that weight on their feet helps them to develop stable muscles in their hips and to have strong bones. Laying flat on the ground does not accomplish that. So we want to get kids out of laying, out of sitting, and onto their feet. The other good thing is that it stretches the leg muscles, which can help children who have any kind of disabilities related to musculature to help prevent contractures and deformities. For all children, being in standing also helps with breathing, with getting their blood circulating, and with going to the bathroom. So the more children are on their feet, the better. Children with disabilities that affect their movement and posture need their parents and caregivers to learn and use good positioning strategies. We know from the research that good positioning improves a lot of outcomes for these children. The overall big aim is we want to enable the child to experience and develop more normal ways of moving and prevent secondary complications. And those secondary complications and some of those problems are below. So similar to what we were just talking about with contractures and things like that, the more we're able to get children into these good positions, the better their tone will be, the less likely they are to develop skeletal deformities. And we also just want children to get used to being in different positions. So the more they move from laying to sitting to standing and all of that, the better. The other thing about good positioning that's really important to think about too is that it also can just help the child be able to relax. We want them to be comfortable, and we need them to save their energy for doing the task. So like we talked about earlier, the more stable they are, the more energy and effort they can put into the task rather than putting that into just trying to maintain their posture. And importantly, being in a good position also makes it easier for the child to have good eye contact, to talk and communicate with their caregivers, and to interact socially. So when we think about babies being in all different positions, part of that is to be able to play and explore. So we're going to watch a quick 1-minute video that talks through very quickly some of the different positions that we can put babies in that can help with their development. So I'm going to stop sharing my screen for 1 second. And let's see. Can you see this video, Kate?
It looks like something's loading, but it's just black.
Let's see. Can you see that? Can you see that? Okay. So here we're going to see a baby playing in a bunch of different positions, and these are things that we can help families think about when they think about positions that we want the baby to be in throughout the day. So the more variety, the better. We want babies to not spend all of their time in a carrier, which is like a car seat or a high chair. So we want to be able to hold them up and put them on their side, and we want to be able to alternate sides. So do it on the right and also on the left. And we can see this baby moving her arms and legs really well in this position. And so in this position, the baby's able to make good eye contact with their parent as well. And we want that tummy time to help with building core muscles that they need to reach their milestones. So we're going to try to rotate them through these positions during the day in order to develop their milestones. All right. The link to this video is right on the slide, so you can watch this again. So belly time for a baby and having that time down on the floor and on their belly. We really, by 3 months of age, we want the baby to be able to be spending about 60 minutes a day of tummy time. And that doesn't mean all at once. It can just be a few minutes at a time during the day so that they get that chance to really strengthen their head and their neck and their shoulders. The other good thing about spending time on your belly is that it also helps to prevent plagiocephaly, which is when babies get a flat spot on their head, and torticollis. Being on your belly also helps them play and explore in a sensory way. So they're looking around, they're touching things, they're reaching. And when we do this with a caregiver, it can also help with bonding with a parent and also with social emotional development and talking. So a concept that we want to think about is anticipatory problem solving when working with the child's parents and family. So when we think about teaching a family something, we really want to collaborate with the family so that they start to think about how to use positioning during the day rather than us just trying to tell them what to do. The reason for this is that children go to different places. They're out in the community, they're visiting people in their family, they're doing other things that their family needs to be doing. So if we're seeing them in one place, we want to make sure that the families learn to be confident about how to position their child in different places, doing different tasks. So we call this anticipatory problem solving. So the more we can help caregivers be able to think through how to problem solve in other settings, the more successful the children will be. So Another thing to think about that we're going to get into in a minute is some of the adaptive equipment that you can use for positioning. So this can be very low tech or more high tech, like a wheelchair. So when we think about what sort of equipment and devices might be helpful for the family, we also want to be very sure that the family is part of this decision making. Bringing new equipment into someone's home or using things in their house for other purposes can be a big change for the family. So we want to make sure that whatever equipment we're recommending, that it meets the family's needs around their culture, around their environment, around, we could have a really good device that we're recommending, but it doesn't fit in the family's living room enough to be used all of the time. So if it's too hard to bring it to someone else's home, then they might not bring it, which means when they get to that place, the child isn't able to participate. So something to think about. The more we collaborate with families, the more likely the child will have what they need. So these are just a few questions as a resource that you can use when working with a family and when thinking about positioning for the child. So not going to read through these, will have these on the slides, but we want to think about these types of questions as we choose positions to put children in, as we think about adaptive devices, and as we educate families. All right, so those were kind of the basics of just positioning for all kinds of ADLs and IADLs and what the child will need to do throughout the day. So sleeping, playing, eating, visiting, socializing. So now we're going to talk a little bit more about positioning specifically for play. So we know that posture and the ability to participate in play go together. So similar to what we were just talking about, the more we can get that child into a good position with good posture, the more successful their play will be. And just like we were saying with babies and toddlers, we want to move them through these different positions throughout the day. We don't want to keep anyone in one position. We can think about this related to play activities as well. So any play activity that we're doing with children, we can adapt it to be done in multiple different positions. And when you think about using play during therapy, part of that is we want the play to be enjoyable for the child, but we also want to be working on strengthening, on balance, on sensory integration. So one of the ways we can adapt play activities related to positioning is to play in different positions. So we can have a child do a play activity in kneeling, on their belly, in side lying, etc. So another thing to think about when we're adapting play and thinking about positioning is to do play activities that use the play materials in different ways. So one of the things that I've done with children who are working on fine motor and upper body coordination is instead of just coloring at a table, sitting in a chair, I'll tape the paper up underneath the bottom of a table and we'll lay under there and draw lying on our back so the child has to move against gravity. Another thing to think about is to put containers or baskets up really high or really low down to put items in as you're playing in order to encourage the child to go up on their toes or to squat down. And these are just a few ideas, obviously. So when you're thinking about playing, think about changing it up, change the child's position and change the position of the materials as well. All right, so for this slide, I'm going to not play the video for you, but you will have the link right here. So one of the things that sometimes we think that parents struggle with is coming up with ideas to work on tummy time when the child at first, especially when they're very young, they may not enjoy being on their belly all the time. So one of the things we want to do is give them different ways to do this. So there's a bunch of different positions that also help with belly time that are also good for play. So one is laying with the baby on your chest. So you can see the mom in this picture is holding the baby. And by having her right there, you can see they're looking at each other, they're engaging. And then when you go through this video on your own, you'll see these other positions as well. So having an eye level smile means putting the child's down on their belly and you being down with your belly as well, so that you can look face to face. And a lap soothe is when we put the baby out across our lap. So they're on their belly, but they're also right with us. So they're up off the floor. And then a tummy down carry is when we hold the baby in our arms, but we hold them laying sort of parallel to the floor. So when we think about pediatric diagnoses that might require planning for positioning, a few that come to mind to me are torticollis, which we're going to talk about in a few minutes with Stefanie, as well as plagiocephaly. In my work from birth to 3 years old, I had a lot of children on my caseload who were born early, so preterm babies. And those babies really need positioning because their skull is still so soft. So had to really think about moving them around a lot during the day, like we were discussing earlier, and making sure that their head, they don't start to get any flat spots. Cerebral palsy is another diagnosis in pediatrics that does require really thinking about positioning and how to get them into a stable posture. So I know, Kate, you had mentioned that a lot of people don't talk out loud during this, but I was just going to ask if anybody can think of any other diagnoses that you've seen in pediatrics that you think we might need to also think about positioning. And you're welcome to put your answers in the chat. So a couple others that I can think of would be spina bifida is another diagnosis that I saw in my practice where children struggle with independent sitting, independent kneeling, and walking. That positioning was definitely part of our OT planning. And muscular dystrophy is also another diagnosis that positioning can be really important.
In the chat, we also had trisomy 21, feeding, and hydrocephalus.
Good. Yep. So feeding is such a big one. And I would say that that is something that parents really struggle with. And so thinking about getting into that upright, stable position, especially as we start to work on feeding where we want the child to be able to pick up a spoon or a fork or a chopstick. And we also want them to be able to pick up small pieces of food. And so just like we were talking about earlier, where if the trunk and the body are stable, fine motor works better. So when you think about feeding and holding a cup or a bottle or a utensil, the more stable their trunk is, the more likely they can feed themselves better. So that's a super good one. Good. All right. So when we think about adapted positioning devices, all that means is, do we need something to help the child stay in that supported position that we want them to be in? So they can be low tech or high tech, and the goal is to help the child maintain their posture and be stable. We want to think about positioning the child's feet and legs and pelvis or hips, because that influences the child's trunk stability as well. So some low tech devices for support would mean using things that are already available, things that are already in the house. So leaning against a wall, sometimes families will have a child sit where the two walls meet so that it gives them a little bit of support on both sides. We can prop them with pillows or rolled towels. We can use a lap board, which is when we have like a little hard surface with a soft beanbag bottom so that it can kind of sit on the child's lap and be used to put toys on. And the other thing is to use the parents and caregivers as support as well. So a parent sitting on the floor with a child sitting between their legs with their back against the parent's chest is an easy way for a child to feel secure and have some support. And as the child gains strength and coordination, the parent can move away a little bit, but still be right there. And then, of course, there's some more high-tech devices. And for some families, these are available in the healthcare system. And for some families, they're not. But these would include things like wheelchairs, customized cushioning setups, and orthotics. So we have a big range. You know, I think in the US, in the United States, we tend to think that families always want high-tech devices, but what I found in my practice was if there's something that can be easy and simple to use at home that a family already has, for a lot of families, that's much preferable to bringing in new things from the outside. So again, we want to collaborate with families and make sure that we're making decisions that meet their needs and that fit into their day-to-day. If we order someone a wheelchair that's super heavy and they're unable to bring that wheelchair anywhere else, is that really the best strategy? Probably not. So important to spend time having good conversations with families. Another thing to think about is having alternative body positions during play. For children with disabilities that impact their strength, range of motion, movement, endurance, all of these factors, playing in alternative positions can be helpful. So I think most of us think of children playing always in standing or sitting, but sometimes for some children, it might be much more calm and less demanding position to be in side lying rather than in sitting. So something to think about, how can we position children in different positions while they're playing in order to make the task not so challenging? Okay, so another thing to think about is positioning children in sitting so that they can have good support while they're playing for children with neuromuscular conditions. So again, we want to position them to allow for as much movement as we possibly can, staying in that window of being safe. So we want feet that are supported on a flat surface. We want their hips to feel secure. We want their head and trunk a little bit forward as opposed to a little bit back. I would say one of the biggest things is we want their arms and hands in front of their body. Some children might need additional stability at the hips and trunk and head, depending on their seating and what they need. And these can include things like supports on the sides, having a seatbelt or a strap across your hips, having a headrest, having a tray. So depending on what kind of more high-tech-ish devices they have, those can also be helpful with seating. All right, so I have 2 slides left in this section about positioning, and then we're going to move on to talk about torticollis. The pictures on this slide and the next slide are from a site called physiopedia.com, and the link is on the resources slide at the end of this presentation. So when we think about the positioning strategies that we've discussed so far, I wanted to think about what does that really look like for a child if we want them to play and be in a functional position. So here's an example of a child in a position where they have too much extension. So depending on a disability that a child has, the disability may cause them to have too much extension or too much flexion. So in this slide, we're looking at children who have their head back. They might have their head turned to one side. Their arms and legs are not moving symmetrically. And a lot of times children, when you are in that very, very extended position, it's very difficult to bring your hands to the middle. So if you can't bring your hands together, it's going to be very difficult to play. So we can see in the first example that the baby would not be able to play in this position because her hands are not at midline, her head is turned, and she's overextended in her trunk, similar to the girl in the image below. By positioning the baby in the seated position, we can see that play would be much more successful. underneath the seated baby, we can see a child in side lying. So by putting them in this position, you can see with simple rolled up towels, they can have support behind their back. They can have support under their knee and under their head. And then now their hands are in a functional position to play. So they're able to see their hands, they're able to see the play materials and function much better. And lastly, on this slide, we see that this child in the chair is in too much flexion. So her hips are pulling forward, her chest is going down towards her knees. And you can see that her hands and wrists are also flexed. So by being in this position, all she's really able to do in this picture is kind of try to keep her balance and stay in the chair. So there isn't any way for her to play or do other activities in this position. So you can see in the example of the better position that by moving her to be in a prone position on her belly, she's able to lift her head to see the toys. She has her hands in front of her body and at midline so that they can play with the toys. And if a caregiver was sitting in front of her, they would also be able to see eye to eye and have social interaction as well. So she went from a very flexed position to a more extended position, which is what we want. So that is the end of this section on positioning. Does anyone have any questions before we move forward? All right. So Steph, if you want to take over, I'm happy to advance the slides if you just let me know. Next slide.
Perfect. Thank you, Cathy. Great. So now we're going to move on to talk about torticollis a little more specifically. So we will watch a super short video, and Cathy, if you just click on it,
Sure.
if you want to jump a little bit in to the 30-second mark, that would be great. So this is just going to go over a really brief description of what torticollis is. Perfect.
So
Thank
first,
you.
let's talk about what torticollis is. Torticollis is a tightness on one side of the neck, which is typically demonstrated by a tilt towards one side and an upward rotation towards the other. And when we're saying what side the torticollis is, we're actually looking for the tilt. So on what side is the ear closer to the shoulder? That is the side of the infant's torticollis. Now, one way that I tell my parents to kind of look and see if their infant might have torticollis is actually to pull out your phone and to scroll through the past few weeks of pictures and look and see, especially if your infant was in a car seat, a bouncer, a swing, or laying on the floor, if their head is consistently tilting in one direction. If they're consistently doing the tilt in one direction, that is kind of a red flag for torticollis and something that you would want to seek out some more information for. With torticollis, there are two things that we work on in regards to.
We can pause there.
So since there is the bending, we work on a stretch that works on that tilt, and we also work on a rotation stretch.
We'll go over these stretches in a minute. Great, we can go to the next slide. And yeah, I really like the way that she kind of described what torticollis is. So we're, looking for that tightness on one side of the neck, and then also that like upward rotation to the other side. And I think it was, which it can be kind of confusing if it's the right torticollis versus left torticollis, but kind of like in this first picture here, you can see that the baby's head is tilted, or their head is tilted towards their left shoulder. And so that would be left torticollis. And then their head is rotated to the other direction because, on the left side, that's where we have the tightened muscles, which makes it more difficult to be able to turn to that left side. And these screenshots come from a video that is linked later on in the PowerPoint too, that kind of goes over some more information. But also this second picture, just showing that, all the muscles from our neck to our upper back muscles, those are all connected when we're looking at torticollis. Great. So yeah, just a little bit more information. talked about the tightening in one side of the neck, looking at that tilt in one direction and the limited rotation. This can be fairly common in newborns. It can come from due to positioning in the womb, difficulty during childbirth, or just post-birth positioning. And we can see improvements with exercises and with positioning anywhere from 6 months to a year or longer. And so if you do have clients with this diagnosis, whether it's OT or PT, you're going to help the family to learn exercises and support positioning. But you can, consult with the child's doctor if, they're not responding to these exercises, and then a surgical release of the sternocleidomastoid muscle might be required. And it is really important to treat this early on. Early intervention is always better, because if left untreated, it can impact our facial structure and the curvature of our spine. So early intervention is really key. And just some signs and symptoms that might be seeing in your clients or with your families before having that diagnosis. Like she mentioned in the video, you might just see the baby tending to only turn their head in one direction, or they might prefer to look at you over one shoulder versus turning their head all the way to the other side. They might have trouble breastfeeding or bottle feeding on one side, and might only prefer to do breastfeeding or bottle feeding on that side that's more comfortable. And again, they can't completely turn their head in the opposite direction. So our treatment goals are to try to loosen the tight muscles on the tilted side and to strengthen the weaker muscles on the other side of the neck. And so we want to incorporate the stretches and activities to facilitate that movement and range of motion. Great. And so these are just some activities that you can incorporate into your treatment sessions and into your work with your families. And they're really simple things. So I'll kind of give a little description of these, but there is a video that gives examples of how to do these. So one is just tracking a toy. You can have the baby on their belly, and you can have them visually focus on a preferred toy in front of them, and you're just going to slowly move it from one side of their head to the other side, so that they're trying to rotate their head and neck from one side to the other. So this is, pretty simple and can be done in different positions, not only on their belly, but it can be done while they're sitting up. There's also other strategies and activities that you can do with the baby on your chest or on your belly, such as having the baby on your chest and leaning back. And so they're having to activate their neck muscles to be able to keep their head and neck upright. Another example is placing a child-safe mirror on the side of the crib, or maybe a space that they play in, or even a preferred toy, so that they're encouraged to look in that direction that's hard for them to turn to. Another one, side chats, is just really simple. When the baby's laying down, you can get on the left side of them and talk to them and engage, and then move to the right side, just encouraging them to turn their neck and their body in those two different directions. There's so many ways that you can get creative with the things that your family are already doing in their daily routines, with the toys that they have, and just different ways to incorporate getting that movement of the head and neck. Yeah, and these are just from the video. These are just picture examples of some of the things that I just described. So the toy tracking, you can see here that it's actually done on their back. So just taking that toy and moving it slowly from side to side can be a really great and simple activity. And then those side chats of laying the baby on their back and moving from one side to the other. And these are just some more positioning images that we've already talked about. And later on in the resources of the presentation, these pictures came from a handout that's publicly available for free online. And so these are really great handouts to give to caregivers so they can really see these different positions that they can incorporate throughout their days. So yeah, this is just a resource. And now I'll go through 2 of the recommended stretches that this OT talked about. So this stretch is a rotation stretch. So you're having the infant sit against your chest. You can support them from the bottom. And so this is going to be just stretching their neck. And so when you're turning the infant's head, you want to go from gently from the forehead and not from the jaw, because you don't want to put pressure on that joint. And so when you come from the forehead, you want to just gently guide their head toward the side that's difficult for them to look at. And you want to hold this stretch for 2-3 minutes or for however long they can tolerate. And it's really important, you want the infant to be relaxed and calm, because that's how you're going to get a better stretch. So if they start to become fussy or kind of show that resistance, you want to stop the stretch, because that's not going to be a successful, stretch for them. But if it is something that they're tolerating, you can make it more fun. You can walk around while you're in this position with them. You can sing to the baby to help keep them engaged. So yeah, this is a highly recommended one. And then this next one is called a football hold. So this addresses that tilt that we see. So you want to place the infant's tight side against the caregiver's arm. So for example, for the right torticollis, you want to place the right side against the caregiver's arm. So, their head is going to be tilted towards their right shoulder. So that's the side that you want against your arm. And you're going to thread your arm through the baby's legs, and you can hold the bottom of their shoulder to make sure that they're not, hiking up their shoulder as a compensatory movement, because this is a challenging position for them to be in because of that tightness. So you want to kind of give some stabilization there. And then again, you're taking the palm of your hand on their forehead and gently guiding the forehead up to what they can tolerate and holding that position. And infants tend to really like this stretch. And so they'll kind of like relax into your arms sometimes. And again, you can make this more engaging. You can walk around, you can stand in front of a mirror to, give them that, that connection and that visual feedback, or sing to your infant. And there's also videos of where she walks you through how to do this stretch as well. Yeah. So this slide is talking about how to incorporate different torticollis treatment strategies into the daily routines of your families. And with torticollis, the carryover with the caregivers is really important, and that's how you're going to see change. And so I'm really thinking about, like, what are the caregivers and families already doing during their days, and what are kind of these adaptations and different changes you can make to their already established activities. So these are really simple, just positioning strategies. So, anytime a caregiver picks up a baby, you might be right-handed or left-handed. And so you might tend to pick a baby up a certain way. And so if you're always picking them up on your right side, try picking them up from your left side to give them that opportunity to strengthen that other side. In terms of sleeping directions, when you can change the direction that the baby lies in their crib when they're sleeping. So you can alternate placing their head at the head of the bed one night, and then the next night you can place the baby's head at the foot of the crib. And this is really important because anytime you walk into the room when the baby's in their crib, they're going to look at you from that same side. And so by switching the placement of their head, one night they're looking at you from their right side, and then the next time they're looking at you from their left side. So this is a really simple thing to do. And just a reminder that here in the US, we always place the babies on their back to sleep. And with this too, kind of a way to remember this is that you can say, okay, all the even days. So today is June 13th. So today's an odd day. So on odd days, I place the baby on the left side, and then on even days, you place the baby on the right side. So it's kind of these simple ways to keep track of these things. For car seat positions, when they're in the car seat and they're having that tilt, you can use a rolled up towel to correct that head position. You don't want to use a rolled towel when the infant is sleeping or unsupervised. But with that supervision, like Cathy mentioned, you can use those really simple things that you already have around the house, like a towel, to kind of support that positioning. And then in terms of babies being in a carrier too, you want to make sure that they're having the opportunity to look both ways. And so, if they're always looking towards the right, then, let's turn your body around so that they're encouraged to look at the left, to the left side, to see what's going on in their environment. Already talked about this a little bit, but that home carryover is really key for treating torticollis. So finding easy ways that caregivers can incorporate these strategies and activities into what they're already doing. And it's really great to try to use different strategies to support caregiver education, whether it's using visuals or writing down instructions or just other methods to make sure that, we're doing that parent coaching and giving the parent opportunities to learn as much as they can while we're there, so that they feel empowered and they feel like they have the knowledge to, carry over those strategies when we're gone. And just general tips for parents and therapists, you always want to work within the baby's tolerance and stop the stretch if the baby starts to resist the motion or become fussy. You don't want to feel like you're forcing any motion. And again, there's lots of ways that you can keep the baby engaged by using their favorite toys or giving those opportunities for social connections with you. And these are some more resources, like I mentioned. A lot of these are handouts that are available, and you can give these to families, and then some more stretches and videos for those. And just some more stretching videos, lots of options. Great, and we'll just quickly go through plagiocephaly. So this is that flat head that can be caused by, the baby's head being in the same position for an extended period of time. So, for this, it's really important, like Cathy mentioned, to have the baby in different positions throughout the day. We don't want them to be, laying on their back for too much time, because especially, whether it's a preterm baby or just a really young infant, we can get that abnormal development of the skull. And something that's common here, if as the baby gets a little bit older and positioning strategies or other treatments aren't working, then sometimes a molding helmet is recommended by a doctor. But there's lots of preventative things that we can do to prevent this, and also some other compensatory strategies that we can use. We won't show this video, but this is another video that you can go through that also just gives more information about kind of how to monitor plagiocephaly, and if it's something that that you're starting to see but you're not sure of. So can kind of guide you of when to encourage families to get that help. Yeah, just more positioning. A lot of this is what we've already talked about, but just encouraging those different positions when they're awake, encourage tummy time, encourage them to be inside lying in these different positions. Similar to what we talked about for torticollis, alternating the side of the crib that the baby sleeps, where their head is in their crib, can also help to prevent, that flattening of the skull. And throughout the day, just limiting time spent in those containers, like the car seats or the swings or the bouncers, anytime where their head might be up against a surface, we want to limit that when possible. And you can always carry your child in an infant carrier or place them on their stomach. And so finding these ways to give your families, different strategies is really important. And if a flat area starts to develop, you can use things like using different toys to encourage them to, look to a different side, and again, decreasing the amount of time spent in that position.
Mhm.
Thank you so much. These are our emails, and we're very grateful for the opportunity to talk to you all today. And thank you, Dr. Barlow.
Yeah,
Thank you.
thanks.
This was fantastic. You guys did a great job.
And just to show, there's a bunch of slides at the end that have links to the resources that were mentioned in this video.
Great.